because I was, yeah.
Okay, go ahead, but I challenge you to.
Yeah. I don't know if any of you in the audience here were at the Presbyopia Day, but there is consensus now amongst everyone, including optical scientists, that inducing the right amount of cerebral dilation in the cornea on the visual axis, not on the center of the pupil, is actually beneficial to the depth of field. And one of the things that you may have read in the January issue of the JRS this year, in which we published Hyperopia up to +6, is that with a micro monovision profile, you're able to get continuous near, intermediate, and distance vision in a way that you cannot hope to get with refractive lens exchange, and certainly not with the compromises induced by multifocal lenses. So, and the fact that 30% of intraocular surgeries require a corneal procedure for fine-tuning anyway. So I'd rather do two corneal procedures than one intraocular and one corneal.
One sentence, then with all respect, you showed us the newest data from your data set.
Of course,
but you show me here literature from 10 years old.
Well, I'm sorry, but this is
sorry, but these are surgeries done in 2000, and we are now in 2010 almost. And we recently looked at accuracy, just for accuracy point. The accuracy is still has improved. It's better.
Okay.
And with all fairness, because you just showed
I'll give you that.
Recent data.
I don't think I was selecting. I actually did a full literature search last year, so maybe whatever came out since July of last year, I will not have included.
If anybody in the audience wants to make a contribution.
But I think you made a very good point. I don't want to stand here and say that everyone needs to go home now and do +5s. Okay, I'm not saying that. What I'm saying, simply, I think that Julian and I have just given you a 20-minute symposium on the state-of-the-art of hyperopic corneal surgery. What Julian has talked about is what came in the past and therefore set very low limits. And what I'm talking about is what is in the future, not what is in the present, because as Manny pointed out, we don't all have the ability to measure epithelial profiles, we don't all have third-generation ablation profiles for hyperopia. So I think what we've gone through is the spectrum of past to future. And I think that it'll be very interesting to see over the next 5 years.
Well, Dan, I'm just going to challenge you a little bit here before the audience comes in that, I mean, your best corrected acuities with the hyperopic group you have are relatively small. I mean, they're low. You only had a certain percentage you achieved 6.6 beforehand, relatively small number. And you're saying that once they're optically corrected, obviously because of the lack of magnification, that their acuities will get less as well, which is basic optics. But I mean, you had 17% on your one slide that reduced by 2 lines or more of vision.
One.
Is there any pressing question?
One line, Julian. One line, Julian.
We would like to include the audience, of course. Is there any question we have here? Is there anybody?
Yes.
We have to.
We were already over time, so we'll
okay, good. One question.
There it is.
Yeah.
Just one question. As Dr. has said that you cannot implant multifocal IOLs in these cases where you need refractive lens exchange. And you say that you have to compromise on many counts if you are implanting a multifocal lens. So, do you advocate that multifocal IOL should not be implanted in cataract surgery?
Yeah. The question is a little bit away from basically from the treatment of LASIK, but of course the issue of multifocal lens implant in lens surgery is a huge other topic, I think.
Yes,
so.
it is a huge. I have a lot of slides on that, but I don't think it's not the place to discuss that. But
no.
Well, I have to curtail the discussion now because due to other speakers, the next controversies. But I want to thank both Dan and Julian for the symposium on hyperopic laser vision correction, and I think we should show appreciation as usual. The next controversy, I'll just tell those at the back that there are seats at the front in the wings if they want to take advantage of them.
Thank you also to Dan and Julian. And the next topic is basically, we know we see an increase